Okay, it's 1:02, so I think we'll go ahead and get started. Thank you everybody for joining us. Today, we, the Department of Healthcare Policy and Finance, are here to visit with you guys about our brand new program, the Nurse Assessor program. So most of you know me. I'm Katie Dobler. I am a registered nurse and the Clinical Operations Division Director here at the CCQI office. And I have brought along a partner with me today. So I'll go ahead and let Erin introduce herself.
Hi, everyone. I'm Erin Thatcher. I'm with the Office of Community Living, and I oversee many of our benefits, including private duty nursing, home health, and home support services, CDAS, personal care, homemaker. So all those in-home services that your patients need once they leave the hospital setting, adults and children.
Awesome. Thank you, Erin. So Christine, we can go ahead and go to the next slide. So you guys know our mission. You hear it every time you hear me speak. So our mission here at Health First Colorado is improving healthcare equity, access, and outcomes for the people that we serve while saving Coloradans money on healthcare and driving value for Colorado. Christine, you can go ahead and go to the next slide. The purpose of our meeting today is to educate you guys, which the audience that we're talking to today is all of our wonderful case managers and discharge planners in as many hospitals throughout Colorado that we could get connected with today. So today you guys are going to learn about our new Nurse Assessor program. This may be new to some of you. Some of you, I think, have already heard about it a little bit. So we're excited to share this information with you guys. Erin and I, this may be the shortest presentation you ever see us do. I think it has like less than 10 slides. So if you guys have questions while we're going through them, go ahead and throw them in the chat and we'll answer them at the end. And then after we're done with the slides, we'll go ahead and take questions too. And just like always, you guys can ask questions however you want. You can come off mute, raise your hand, throw them in the chat. And if you want to send them to our inbox later, you can absolutely do that too. Okay. Okay, Christine, next slide. So why implement a Nurse Assessor program? Let's find that out. So the Department of Healthcare Policy and Finance requested funds, and they were ultimately approved by the legislature through a budget request referred to as R10. We do have that hyperlinked for you guys to see when we send out the slides later. That was done in 2023. The Nurse Assessor will eliminate any conflict of interest that currently exists in the process for assessing skilled care needs. So currently, the way our model looks, the provider, which oftentimes are home health agencies, are determining the skilled care needs that the member needs. And oftentimes it looks like we have seen a trend moving towards private duty nursing. And sometimes we ultimately end up having members that the home health agency has started out on private duty nursing that actually could have probably had their needs met in a lower level of service. So like within long-term home health, through HMA, and oftentimes we're finding that members weren't fully educated on all of their amazing options that Colorado offers for our care delivery systems. So the Nurse Assessor is going to take those lessons that we have learned from our previous models, and we are going to remove that conflict of interest and make it more of a holistic assessment. So the Nurse Assessor will do one assessment. Oftentimes, these members who are accessing long-term home health, private duty nursing, and sometimes HMA, sometimes all three, have to go through like 5 different assessments. So we are collectively making it so it's one assessment, a one-stop shop, and members can find out what their needs best meet to what benefit, and then they'll discuss the different care delivery options too. So the Nurse Assessor will be responsible for providing education to members on all of the available services that the member's skilled care needs meet. So this will enable the member and and it'll give them an opportunity to choose the different service delivery options that best meet their needs, because everybody's different. We have members that live in the urban setting, we have members in the frontier setting, members in the rural setting, members with lots of family support, and members that don't have a lot of family support. So we want to make sure that the nurse assessor is a better opportunity for members to customize how this needs to look and works best for them. So the nurse assessor will provide a holistic assessment of the member's needs specifically for skilled care services. Pay special attention to this next part that I say. The nurse assessor is only going to be needed for members that are going to be accessing private duty nursing, long-term home health, meaning registered nurses, LPNs, and CNAs, and then health maintenance activities. It is not going to touch long-term home health therapies or any of our other benefits at this point in time. It's just going to be these three. So make sure you make mental note of that. The nurse assessor is going to make referrals to other resources within our care delivery system. So obviously, you guys know that our regional accountable entities, or our RAEs, are our case management entity once they leave the acute care setting. So they will definitely be working in a collaborative way and referring into the RAEs. Okay, Christine, next slide. Okay. I'm a nurse, so I love an infograph. So hopefully you guys do too. So how will this nurse assessor process work? So the first step is going to be the member has an identified skilled care need. A referral is made to the nurse assessor vendor. And then last, the nurse assessor reaches out to schedule the assessment. So this is a big change. We're very excited about this first opportunity. Normally, when it comes to assessments like this, the medical provider is the only one who can request the assessment. We're opening the nurse assessor up so that members can request an assessment as well. So the referral can be made by a member or the family of a member, a case manager, so a case manager within their case management agency, or even you guys' group, a home health agency, a regional accountable entity, a hospital discharge planner. So what is very specific to you guys, and since you are getting your own special session of education on the nurse assessor, is this next key point. We do anticipate that hospital case managers and discharge planners will need to submit a nurse assessor referral for members planning to utilize the private duty nursing benefit for the very first time. Oftentimes those members are hospitalized and almost at their point of discharge when you guys identify that. And so this is going to be the opportunity for when members are hospitalized that case managers and discharge planners will be involved in the process. So you guys will be able to submit a referral to the nurse assessor and or a referral to a home health agency for private duty nursing simultaneously. So oftentimes you're probably going to end up doing them at the exact same time, but we also are not requiring that you do it in a specific way, because there are all different sizes of hospitals, all different types of work processes and pass-throughs. We really want you guys to define what works best for your teams. The nurse assessor vendor will be required to accept a referral via multiple avenues, and the nurse assessor will have a contractual requirement to set up the assessment. It can be either in person or virtual within a specific time frame. Now, for those members specifically that you guys are going to be caring for, the hospitalized member, we do have a special fast-tracked type of assessment. It is called an expedited review. So the expedited review from beginning to end has to be completed by the contractor in 72 hours. Okay? These expedited reviews will be conducted based on specific criteria, ensuring that only urgent referrals are prioritized and addressed promptly under this category. And expedited reviews will be screened, ensuring that they meet that established criteria, and that criteria does obviously include a pending discharge from the hospital or current hospitalization. Telegen will be providing trainings on submitting referrals in June. We're in June, so they're going to be happening this month. And we recommend that you guys attend those trainings. So Telegen is going to end up being the contractor that was chosen to do this nurse assessor work. The nurse assessor referral should not delay care or the discharge of a patient. That's why we opened up the opportunity for you guys to submit the request for a nurse assessor assessment and the ability to go ahead and submit your referral to your home health agency as well. We don't want to hold up the show or delay care. Okay, Christine, next slide. I'm going to go ahead and let Erin take you guys in for a closer look.
Thank you, Katie. So when we are talking about the referral process as a discharge planner or a case coordinator, it depends on your establishment, how you get people discharged home, but essentially you'll make that referral and then the nurse assessor will contact the family and the member to get that assessment scheduled. And so they start with looking at what the needs are on an intake call. And the intake call is something that's done over the phone and at the point where they also schedule the visit. So once the visit is scheduled, we will have a registered nurse who will work through what's called the skilled care acuity assessment. And there are a couple different parts of this, but essentially we're looking at any skilled nursing needs as well as activities of daily living needs and any intermittent nursing needs. So if someone needs intermittent wound care or medication setup, that can all be established through this acuity assessment. So we're looking at people who might have a need for skilled nursing one time a week, or we might have someone who needs 24 hours a day of private duty nursing, for example. So the skilled care acuity assessment really goes through all their skilled care needs, looking at what their medical diagnoses are, their medications, what kind of DME or equipment they have, and really what the member is going to need to be stable in their home environment. We also look at the tasks that need to be completed and whether those are skilled or unskilled. So we are going to be looking at people who might have a need for personal care, but they also might need CNA or another type of skilled benefit to help with, let's say, transfers, for example. And then the last point on this first bullet is really to state that if there are skilled or non-skilled or unskilled needs identified, we can gather that information through the nurse assessor visit. And there's a separate document we'll be completing called the Direct Care Services Calculator. That may be familiar to some of you who've worked with HCBS or home and community-based services in the past, but essentially we're looking at our personal care, homemaker, and then skilled tasks that might be needed. So by completing this direct care services calculator, people who might need supplemental services like homemaker, those will be established during this assessment, and then it'll be provided in the recommendation letter. So during this assessment, the nurse assessor will provide education on all the different types of service delivery options available. So as Katie described, we have various options in Colorado. So the heaviest one is obviously going to be private duty nursing, where we provide the most intensive services, going down to certified nurse aide and RN, LPN services. And then we also have something called health maintenance activities, which is a skilled type of service provided in a self-directed service delivery model. We won't go into all the details with that, but just know it's a way that a lot of people get care because we permit family members to do the care and we don't require licensure or certification. So in a nutshell, a person who is not a CNA or not an RN could be paid to do the skilled care through health maintenance activities. And that is an optimal solution for a lot of people in Colorado. So the nurse assessor is going to provide education on all the different options and really help the family and the member and whoever else the member would like to participate in this assessment process figure out what care looks like once they go home. We will have the potential to collaborate with the member, and again, anyone else that they'd like to be involved in that assessment. So if they've got an advocate or if they have a case manager, they like to be present, we would encourage those people to participate in the assessment. And then lastly, the nurse assessor has a recommendation about what the options are. So it's going to look a little bit different for everyone because the assessment is very individualized to the person's needs and their abilities and their age. So at the end of the assessment, we will generate a recommendation letter outlining all of the potential options. Next slide. Okay, Katie, do you want to take this one and I can take the HMA? You want to take the first?
Sure. So how is the nurse assessor's recommendation used? That is a great question. Let's find out the answer. So for long-term home health and private duty nursing, the recommendation will be used by the utilization management vendor in their medical necessity review. So while that recommendation may play a significant role in the review, the recommendation is not the sole determinant in the review. Supplemental information such as nursing notes, the plan of care that is developed with the home health agency and the ordering provider, and etc. will definitely be used to review as well. All factors and documentation will be used in the determination. So the nurse assessor recommendation is going to be one of the tools that's in the toolbox that the PAR vendor then ultimately determines medical necessity for the need. So this isn't going to apply to you guys, this will apply to the home health agencies, but the home health agency is going to need the nurse assessor recommendation before they submit their PAR. Okay.
Okay, thank you, Katie. And I'll take the HMA or health maintenance activities portion. So as I mentioned before, HMA is a self-directed delivery option for skilled care. So what that means is we permit trained family members or friends or other individuals to perform skilled care tasks without licensure. So they don't need to have a nursing degree or a certified nurse aide or a CNA certificate. They don't need to be a LPN to do this skilled care. This is currently available in our home and community-based services or HCBS waivers. And so for people who might need HMA, we would connect them with a case manager in the home and community-based services environment. So at that point, the HCBS case manager will use that recommendation to create a prior authorization and get services approved. So for those of you who are familiar with HCBS, we've got a lot of changes happening in that arena. We'll put some links in the chat about Community First Choice, which is another upcoming thing happening July 1st. But essentially, if we want to approve HMA, that's something the nurse assessor will talk about with the family, and it's another way to get care outside of a traditional home care agency type setting. In addition, if someone needs homemaker or personal care, that's how the member will access it, is through Community First Choice or one of the HCBS waivers.
And Erin, you bring up a great point, and so I definitely want to make hopefully an impactful statement that will be helpful to the case managers and the discharge planners that are working in hospitals in either the frontier or rural areas of Colorado. A lot of you are in home health agency deserts where there is either 0 home health agencies or 1 or 2, and their censuses are too high, and sometimes they're not taking new patients. Oftentimes in those 2 specific settings, an HMA option is a great opportunity to still get that member some skilled care. It's not going to be done by a licensed professional. It can be done by whoever they choose to do, but that is a great opportunity if you are in one of those deserts that does not have any home health agency to service it.
Absolutely. Thank you, Katie. And I'll just mention too, self-direction has been around a really long time. We have been doing it in Colorado since 2002, and we are a leader in the nation in self-directed benefits. And so you probably already have folks who are accessing self-direction, including health maintenance activities. You just may not know that that's how they're getting their service needs met. So if you'd like more information, please, we'll put information in the chat of how you can reach out to us, but we're happy to provide additional information on these benefits because they are a little different from what you might be used to. Thank you. Okay, I'll take this one too, Katie. I apologize. It's like going on mute. Okay, so our timeline. So gosh, we're already at June. So we've been working on the nurse assessor implementation, as Katie mentioned, going all the way back to 2023, maybe even 2022. So right now we have identified a vendor, which is Telegen, who will be doing the nurse assessor activities. That contract has been executed, and we've been working on training and getting that those activities on board. So we are intending to provide training to stakeholders about the nurse assessor referral process and kind of the nuances we discussed a little bit earlier. We're getting our systems ready to be ready for launch July 1st of 2025. So it's just in a couple weeks. In July, the nurse assessor process will be live, and they will be able to take referrals, and they will begin conducting assessments. So until then, continue doing what you are doing right now. There aren't any changes. And then once the nurse assessor goes live, we will have additional information about how you would do those referrals. And then in the meantime, if you see a training opportunity come up, please take it so that you can be prepared for what the system looks like. And on the back side, it's very, very easy to look at. It's like 5 questions. It's very simple. It won't take a lot of time to learn, but hopefully it'll help streamline this process for you all. Next slide. Okay, so the best way to contact us. So I'm again in the benefit side of Medicaid at HCPF. My team can be reached at this homehealth@state.co.us inbox. And then we do have the nurse assessor webpage that has a lot of great information on it. But if you'd be interested in seeing what the acuity assessment looks like, it's posted there. We have consumer videos if you want to share with someone about what this is going to look like. They're really cool to see the process from start to finish. And then we also have the budget request R10 linked there. So this great information is available for everyone on our website, and I'll put it in the chat. And I think we're ready for maybe questions.
I had 2 points that popped up in my head, Erin, while you were talking. And so for this specific focus group, I think that they would be great to share. So we're going to, once we get the trainings that Telegen sets up on how to use the portal to submit your nurse assessor referral for an assessment, we will go ahead and send those trainings out to everybody who is logged on to this meeting, since we'll have your email addresses. So you guys get a personal invitation to the trainings. And then second, those of you who have come to a lot of my inpatient hospital transition meetings know that I was a case manager for a long time in the hospital setting. And this will be the easiest referral that you ever submit. It is a simple portal with, it has probably around like 6 data fields that you'll have to fill in. But most importantly, there's no documentation that you have to upload or submit. So I think that'll make it really easy for you guys, especially in the hospital setting. Now, should you have your discharge instructions done or your discharge summary, your physician's on top of it and already has that done, we would love to have you guys upload that when you submit the referral, but it'll be one of the easiest electronic referrals that you guys submit. So that being said, let's go ahead and open it up for questions. I'll take Eric's question in the chat first. Hi, Eric. How are you doing? So thank you for this information. How do we find and sign up for the Telegen process and the focus training? So Eric, we have you guys' team listed from previous trainings, and you guys are usually obviously at a lot of our informational meetings. So any of the email addresses that we have from your team, they will get an email saying specifically when those trainings will be. We'll also put all the training options up on the Nurse Assessor website where you guys can find them as well. Telegen is doing their trainings over about 2 weeks, I want to say, and I want to say that there's between 3 and 5 different times and opportunities that you guys will be able to attend. You can attend all of them if you want. You can just attend one, and then we'll have them up on the Nurse Assessor website as well, so you guys can watch them on demand if you have new case managers or discharge planners that you're onboarding in the coming months. And then, like anything else, there'll be a PDF available too with screenshots of the portal of how to like manually go through the submission of the referral. So Leslie, will we be able to access recordings of the meeting and focus trainings? So yes, Leslie, we are recording this meeting. We will put the recording up on the Nurse Assessor website, and then the trainings will be the same way. You'll have on-demand options. And then if it's months from now and you're onboarding a new case manager or discharge planner, or, we've started using the process and you've started submitting referrals and you start to have questions, just submit them to that inbox, homehealth@state.co.us, and we'll help you guys navigate and give you some answers to questions if they pop up. And then, will this be only Medicare, Medicaid, or all carriers? Good news, it is only Medicaid only, so not your duals. It'll just be Colorado Medicaid as your primary payer. Great question, Felicia. I don't know why, but I always forget to say that at the beginning of a training.
Katie, it's actually going to be if a person has Medicaid, they can receive an assessment. So we know many of our people might have Medicare or other primary health insurance. That's okay. Those other payers may not be providing in-home services like personal care, homemaker, or private duty nursing. So if you have someone who has multiple insurance options, like say like TRICARE and Medicaid, you can submit a referral for anyone who has Medicaid, and we would verify that they have active Health First Colorado Medicaid. And I would just add that if you've got someone who's on Medicaid because they've been institutionalized for over 30 days, I would highly recommend that you submit a referral. Our team can work with the family on what that looks like once they come home, and some of the more unique eligibility options for people, especially children who may need long-term care Medicaid. So we can help get that information to them and help streamline that transition home.
That's a great point, Erin. I would just say if they have a Medicaid ID on their face sheet, you have the option to submit a request for an assessment. Mm-hmm. And so to that point, let's talk about our 2 managed care options, because I know we have some of our larger hospitals here who take care of our MCO patients. Those are included as well. So. Okay, any other questions? You guys can raise your hands, you can come off mute, throw them in the chat. But if we don't hear any more and some come up in an hour, let us know. Just go ahead and email the home health inbox right there on the top, and we will get you guys some answers. Otherwise, I'll give you 30 minutes back. That's awesome. That rarely ever happens. So thank you guys so much for all you do. We appreciate the amazing care. You're the organizers of our Colorado Medicaid members when they're in the hospital, and we appreciate it so much. So thank you guys, and we will see you later in June.
Thank you. Bye, everyone.